Actually, I started going to Uganda when I was in college. I was working, sort of observing and helping out in a local Catholic charity hospital, and I had just never seen any of this pathology and just the degree of need and the lack of pain medications and the children with malnutrition and the long lines at the clinic and the inability of a lot of those providers to really make lasting change. I think just having never been exposed to that, you just don't know what those sights and smells and sounds are going to be like until you're in the middle of them. You catch the bug when you're young, and then it's hard to lose it. And to try and get there and make a difference with this group of people. Surgery can make such a huge difference in their lives. Unlike here, where there's usually another surgeon around to do your surgery, they might really not have had access, unfortunately. But what I'm hopeful is that some of these other things will cause that kind of disruptive change that will allow us to, get people access to care and improve the way surgery is done. There's a satisfaction in seeing a learner see the light bulb go on. There's so many residents out there who are interested in global surgery, and to be able to take them on short-term experiences where they can see the pathology, but more importantly to really develop a worldview where you understand what we have and how we're blessed, but then maybe we can turn around and share that and sort of putting that spark into them, and that maybe they'll take that long-term and make it a part of their own practice. Well, I'm really excited about it because when I first got interested in global surgery, I felt like I was just weird. And I felt that most of the people around me in academic medicine thought I was weird too. There are a lot of younger people and medical students especially, and trainees in residency who are just so excited to make a difference. And I find that really inspiring because when you start out, we're all a little bit like bleeding hearts and really think that we can change the world, and then you run up against reality and realize this is a lot harder than I thought. But this wellspring of interest, I think, is really exciting. We need to expand our view as surgeons to look at people as whole people, and that passing on that mentality, I've found that to be very rewarding. I just think you catch the bug and you're stuck, but in a good way.